Hey, did you type that fast?
You did. Well, this is
You're
not
pretty
verbatim,
safe.
it's just rough notes.
Yeah. Wow. Now, you wanna see what the fire looks like? I'll show you.
Well, that's my opinion. At least with these things, I can make sense of it because I'm making notes. Because I'm very familiar with it.
So, yeah. So, otter. This is.
All you have to do is kind of
it
remember,
starts from the beginning
you know,
of
the
the
highlights,
recording.
and then you can search for a word. So if he says
Yeah, you can actually search
bombshell,
through the app,
you
and
search
it plays back the
bombshell.
audio for you. And gives you breaks like this. And you
So really all you're doing is
15
taking
minutes
some
and
highlights.
This is amazing, I gotta get this thing.
Yeah, it's not perfect transcription, but you know,
Right.
when if you go back into it, because the transcriber, then you can export it too. So you can also get the app into the recording and after you stop it.
Is that how it looks?
Yes. You just hit a word and it starts playing. You can pause it, you can back it up, you can fast forward, you can search for the words and lyrics.
So great. And so now I'm forwarding that to the other groups all. How did you do this? No, they're totally right about it.
I did like that little comment
Yeah.
that you said it was. This is the first day you've been late.
In a while.
In a while. That's a first.
Day.
Let's do them any good down there, they can't reach it.
It's true.
It's mostly
And spirit, as it gets picked up.
something like 20%.
Good afternoon. Let's go to a news conference in Chicago where Governor
Just one
J.B.
prank
Pritzker has new
on
information
somebody, some
on
practical joke
COVID-19.
today, and find something to laugh about. On a serious note, today is National Census Day. You might ask, why do we need to proceed with a census right now? Don't we have bigger things to worry about with our battle against COVID-19? And here's my answer. Yes, we are in the biggest battle of our lifetimes against COVID-19, but it's important to look beyond this fight today and to take this moment to think about our future. It's incredibly important to make sure that every Illinois resident, from newborn babies to great-grandparents, is counted in the census. The census is far more than just a survey. It will determine how much of your tax dollars we get back from the federal government, and it will help decide how much power Illinois will have in terms of congressional representation and electoral college votes for the next decade. Based upon our 2010 census count, the last time we ran a census, Illinois today collects over $34 billion per year in federal funding for vital services like education and business investment, child care, workforce training, transportation, and healthcare. But if we fail to count everyone in Illinois, it could result in the state losing over $195 million per year in federal funds for each 1% we undercount ourselves. I know people are anxious and worried right now about the COVID-19 pandemic. We are facing an invisible enemy, and there are a lot of unknowns, I understand. But I think this moment has also illustrated how connected we all are and how important it is that we keep the structural foundation of our society well funded and well fought for. One of the best things that you can do to help our state in the long run, to help our doctors and nurses, our first responders, our teachers, our grocery store workers, our delivery drivers, and everyone else, is to continue to stay at home and take 10 minutes and fill out your census form online. I want to remind everyone that there is no citizenship question on the census. Let me repeat that. There is no citizenship question on the census form. You will not be asked your immigration status, and your information will not be shared with anyone. At the federal level, the U.S. Census Bureau has temporarily suspended in-person interviews and postponed 2020 census field operations. That's the right call for the safety of the Census Bureau employees, census volunteers, and for the public at large. Here in Illinois, we're doing everything that we can to make sure everyone is counted. And because a lot has changed over the last month or two, our strategies have changed too. Our $29 million investment in the census this year is now being directed toward efforts like social media outreach and expanding our remote home-based phone banking, texting, and virtual assistance programs. And with help from our 30 local census hub partners across the state, we're modifying our targeted outreach to our hard-to-count populations, like rural communities, minority populations, blended households, young children, low-income families, and college students, just to name a few. It has never been easier to respond on your own to the census, all without having to meet a census taker in person. You can easily complete the census while social distancing. Online, you can visit my2020census.gov, my2020census.gov, and fill out the census now on your computer, your tablet, or your phone. By phone, call 844-330-2020, 844-330-2020 to fill out the census over the phone. The U.S. Census Bureau offers assistance in 59 non-English languages, including American Sign Language. By mail, fill out the census form that you received in the mail and return it free of charge to the U.S. Census Bureau. So when you have an extra 10 minutes, take the time to fill out your census form. Let me also remind you that for those who want to get a response by text, you have questions that you want answered, you can text to 987-987 and you will get an immediate response. You count. Everyone counts. No matter where you used to live, no matter what language you speak, no matter how old you are, you count. And we are happy to have you in the state of Illinois. I also want to take a minute today to talk to you about healthcare. I've used this platform to describe the efforts that my administration is making to expand and simplify healthcare access for our residents in this time when every individual's healthcare is essential for our collective well-being. To further that effort, I joined Republican and Democratic governors in asking the federal government to open a special enrollment period of the Affordable Care Act to expand healthcare access to Americans during this period of unprecedented health challenges. We have at least 800,000 uninsured people in Illinois, over 500,000 of whom could potentially sign up for the ACA tomorrow if the federal government opened up a special enrollment period. Some White House officials are saying that the president will not be reopening the insurance marketplace in response to the coronavirus. Frankly, this is leadership malpractice. Now more than ever, we need as many people as possible to have access to health care, to seek out testing, if we're ever going to be able to fight COVID-19 and eliminate it as a major risk to our people. On that same note, the Trump administration's continued pursuit of a legal case to destroy the Affordable Care Act, which has provided health care to tens of millions of Americans, is a special insult to the people of this nation at this moment. To seek to kill the ACA at a time like this, not to mention ever, undermines everything that we're trying to do to keep people safe. For Illinoisans who were recently laid off because of COVID-19, I want them to know that they are eligible to enroll in the ACA right now anyway, because of a clause in the act allowing those experiencing a qualifying life event to enroll at this time. If that may be you, please visit our healthcare portal in Illinois called getcovered.illinois.edu. getcovered.illinois.edu. I also want to provide an update on our search. Sorry, I want to give you that address again because I got it wrong. getcovered.illinois.gov. getcovered.illinois.gov. I also want to provide an update on our search for new or renewing healthcare workers. We have now received over 1,100 applications from both former healthcare workers looking to rejoin the fight and from out-of-state professionals who want to help Illinois, many of whom are Illinois residents who happen to practice in a border city in another state. Right now, those numbers are running about half and half, with more applications coming in every day. It's really incredible to watch. The people of this state are truly so deeply, genuinely caring. I want to remind healthcare workers already licensed in the state of Illinois to sign up for an emergency alert system so that in the event of an urgent need, such as those created by COVID-19, our public health officials will be able to contact you immediately to ask that you volunteer your critical skills at that moment. The website to register for that is illinoishelps.net. We're also hard at work exploring options to allow some of our fourth-year medical students and nursing students at the end of their programs to join the fight against COVID-19. Finally, before I turn it over to IDPH Director, Dr. Ngozi Ezike, I want to draw attention to an announcement that my wife, First Lady M.K. Pritzker, Chicago First Lady Amy Eshelman, Mayor Lori Lightfoot, and I made this morning. The launch of a new relief fund specifically dedicated to supporting artists and artisans and cultural organizations impacted by COVID-19. This partnership among the City of Chicago, the State of Illinois, and our philanthropic community, called the Arts Illinois Relief Fund, has already raised more than $4 million to support grant programs for both nonprofit arts organizations and for individual artists, including stage and production members. Additionally, Arts for Illinois has launched a free online platform featuring performers and singers, poets, painters, writers, and other Illinois creatives who have made their work available for the public to enjoy while you're following our stay-at-home order. There are musical performances called quarantine concerts, features from children's theaters, and even the Lyric Opera of Chicago. Really, there's something for everyone to enjoy. Joining us today is Amanda Williams, a Chicago artist and an Arts for Illinois Steering Committee member, who will talk more about this program in just a few moments. Art has always been of incredible importance to me and to my family, but of course, so many of the usual ways of enjoying art together have had to be put on pause. And tragically, our creative communities have felt the financial hardship. When MK, who has always put others front of mind in any hardship, told me that she had an idea to support art and artists in the fight against COVID-19, I was really excited to see what she would come up with. Well, honestly, she's blown me away, and I encourage you to check it out for yourself. People interested in donating to the fund, artists seeking financial assistance, and those looking just to experience art remotely should all visit the Arts for Illinois website at artsforillinois.org. Thank you very much, and now I'd like to turn it over to Dr. Ngozi Ezike.
Thank you, Governor. Good afternoon. Today, again, I bring sobering news with the report of 986 new cases, including 42 additional deaths related to COVID-19. That brings our total in Illinois to 6,980 cases and 141 deaths here in Illinois. Of course, we all understand that these deaths represent people's mothers and fathers and grandmothers and grandfathers and children and co-workers and neighbors and teachers. These are people that are no longer with us, and we extend our heartfelt sympathy to the families that they represent. So many people are working so hard to help protect the health of Illinoisans. We salute our first responders, our military, represented by our Illinois National Guard, our healthcare workers, the truck drivers who make sure that our stores are still stocked, sanitation workers. We're grateful for all of you. But I'd also like to take this opportunity to thank the hardworking staff at the Illinois Department of Public Health. I stand before you each day providing data that our incredible team at IDPH has worked so diligently to collect, to investigate, and to analyze. I'm so proud to be at the helm of the agency at this time and alongside such a talented crew. Public health is like the stealth agency that flies under the radar. Our work is often invisible because of the illnesses and the injuries that we are successful in preventing through our work. But now, the whole world is getting a glimpse of the work that it takes to respond to a pandemic. We are running suspected COVID-19 lab specimens in each of our 3 state labs. We are tracking cases of COVID-19 throughout the state and every one of these devastating losses of life. We are tracking demographic data to keep ourselves honest and ensuring that equity and equal access occurs in testing. On a daily basis, IDPH collects hospital data on the number of beds and how many ventilators. Meanwhile, the nearly 400 babies that are born still every day in Illinois are still being tested at our labs for sickle cell or cystic fibrosis and the 60+ other diseases on the newborn screen panel. We continue to monitor cases of tuberculosis, conduct surveillance for pertussis, Legionnaire's disease, and so many other infectious diseases. We're still processing and issuing birth certificates, death certificates, marriage certificates through our Division of Vital Records. The work that we've always done can't be stopped. So IDPH has been working tirelessly. Team IDPH, I salute you. I'd also like to give a big shout out to all of the local public health departments who work hand in hand with us. They are our essential partners in our fight against this virus. The coming weeks are going to get more and more difficult as the number of cases and deaths continue to rise. But I'm not urging people to despair. Let's be strong and courageous. Don't be terrified, don't be discouraged. The courageous actions that we need to take are well within our grasp. And those actions are the ones we've been saying from the outset. Wash your hands, stay at home, clean frequently touched surfaces. All of these things seem minimal, but these are the courageous actions that are going to save lives and eventually end this pandemic. We are blessed to be under the tremendous leadership of Governor Pritzker and his talented team, not to mention all the state agencies and community partners and business partners who are all helping Illinoisans weather this unprecedented event. No, there's not a vaccine yet, and there's currently no specific treatment, although trials are underway. But what we do have is science telling us that social distancing works, and it's one of our best strategies to get on the other side of this unprecedented event. It is your behavior, it is my behavior, it's everyone's behavior that will turn this tide. We will see an end to this pandemic, and I thank you for your steadfastness. And with this, I will now translate my comments in Spanish. Buenas tardes. Otra vez me llamo, es un gozo Ezequiel, y yo soy la directora de Salud Pública en Illinois. Tengo que anunciar 986 casos nuevos, incluyendo 42 muertes adicionales conectadas a COVID-19. Ahora tenemos 6,980 casos y 141 muertes en Illinois. Es importante que recordamos que estos no son solo números, son personas. Son hijos, padres, abuelitos, maestros, etc. Queremos que sepan que los trabajadores de salud pública, los profesionales médicos y el Estado de Illinois están trabajando día y noche para proteger su salud. Quiero reconocer los trabajadores del Departamento de Salud Pública de Illinois. Vengo aquí cada día para traerlos el dato que nuestro equipo de IDPH han trabajado duros para investigar y analizar. Estoy orgulloso de estar al frente del departamento en este momento y tener un equipo con tanto talento. Muchos no ven todo el trabajo que hacemos diario contra las enfermedades y heridas, pero ahora el mundo está viendo el increíble trabajo que se necesita para responder a esa pandemia. Estamos recibiendo y analizando muestras de laboratorio de COVID-19. Estamos vigilando casos de COVID-19 y cada muerte. Diariamente recibimos información de hospitales sobre la cantidad de camas y cuántos ventiladores, todo eso. Mientras todo este trabajo está pasando, 400 bebés siguen naciendo cada día y seguimos haciendo pruebas importantes sobre su salud. Continuamos siguiendo casos de tuberculosis, vigilando la influenza y tosferina y muchas otras enfermedades. Todavía estamos procesando y emitiendo certificados de nacimiento y matrimonio a través de nuestra división de registros vitales. También me gustaría agradecer a todos los departamentos locales de salud pública que son críticos en nuestra lucha contra este virus. Las próximas semanas serán más difíciles porque el número de casos y los muertos va a continuar a crecer, pero no quiero que la gente se desespere. Los funcionarios de salud pública están haciendo todo posible para detener la transmisión del virus, proteger la salud de los residentes y poner fin a esta pandemia. Todavía no existe una vacuna y actualmente no existe un tratamiento específico, pero lo que sí tenemos es que la ciencia nos dice que el distanciamiento social funciona. Entonces, lávese las manos, cúbrase la tos. Lo más importante, quédase en casa. Como siempre, vamos a seguir luchando para Illinois. Espero que tú también lo harás. And with that, I am happy to introduce you to Amanda Williams, an Illinois artist with a very special message to share.
Good afternoon. I'm Amanda Williams. I'm a Chicagoan, but today I come to you as an Illinois artist. Art matters but artists matter. I'd like to give my heartfelt thanks to Governor Pritzker, Mayor Lori Lightfoot, for your relentless leadership during this pandemic, and to thank you so much for your support that you've shown to the arts and cultural community today with the announcement of the Arts Illinois and Art for Illinois Relief Fund. Thank you. I'm here today representing tens of thousands of artists, brilliant, talented, and passionate individuals across Illinois who have been separated from their livelihood as well. Exhibitions and performances for my friends and colleagues and for myself have been canceled. And I'm seeing firsthand how artists are hurting from this crisis. And it's not just visual artists that I'm talking about. Actors, musicians, dancers, choreographers, playwrights, lighting techs, costume fabricators, wig makers, carpenters, electricians, stage managers, box office staff, ushers, facilities workers, and the many more individuals and organizations that are immediately impacted when our theaters went dark, studios went silent, museums and galleries closed their doors. But arts and creatives are resilient. We too, in some ways, are the front line of being the bellwethers of these moments where we all have to come together as humans. We will not stop making, creating, inspiring, challenging, bearing witness, and bringing hope. In fact, that's all we know to do in these moments. We are here not just to ask for your support, but to also be part of the solution today in this moment of crisis. Even now, we're still creating and connecting, albeit virtually, and we're sheltering in place, and we need the arts now more than ever. Again, thank you to the state of Illinois and Governor Pritzker, the city of Chicago and Mayor Lightfoot, and the foundations and individuals who have already stepped up to provide financial support to my peers, the creative community during this time. I'd like to offer special recognitions to the Arts Alliance Illinois, which has been the leader in bringing together so many funders, artists, and partners to launch Arts for Illinois and the Relief Fund. I'm a member of the steering committee, and I'm there to make sure that the artist's voice is heard. This Relief Fund will provide immediate support to full and part-time creative community workers, as well as arts organizations through a grant process which will be awarded to individuals by 3 Arts and to arts organizations by Arts Work Fund. Individuals and organizations can apply through the Art for Illinois website, artsforillinois.org. Again, that's artsforillinois.org.
You have been watching a COVID-19 news conference with Illinois Governor J.B. Pritzker. Missouri Governor Mike Parson is also holding his daily press briefing in Jefferson City, and we'll take that briefing live when he is ready. Of course, you can get all the latest information on the KSDK app, ksdk.com, and on air at 4, 5, 6, and 10. We now return you to regular programming.